So what is a foodborne disease? A foodborne disease is any disease that's related to food. You eat food, you end up in trouble. That's the simplest definition of that. It can be biological, i.e. a bacteria or a virus or a toxin or a parasite or whatever. It can be a chemical, like somebody with having a toxic material, for example, like mercury, pesticides or whatever. Or it can be physical. إذا عم تاكل شفت شعرة أو something contamination there. And today I will talk about the biological one that's related to today's presentation. How can you prevent that? The first thing in prevention is the safe handling of the food. And I will talk more about how the hand washing and screening of the people who work in restaurants or food handling. And the second key one is refrigeration. As you all know, there is very strict rules in United Arab Emirates. For example, if you order food in this hotel, if the food going to be served inside the restaurant, there is different rules if you're going to serve it outside. If you are eating outside, for example, mayonnaise cannot be in the table because mayonnaise is well known to cause infections, for example, in Salmonella and other. So there is very strict rules to different kinds of food. Typically, it happens or it looks like an outbreak of diarrheal disease. Usually, several people will be affected. However, every now and then we have a different source, sometimes related to the contact to animals, especially when you go to zoos or to animal farms or in water parks. If you go to any of the water parks around, you might get infected. And actually in UAE, the rules are again very strict, and actually it's over strict. Sometimes you cannot get rid of the smell of the chlorine they add to the swimming pools and the water splashes and parks. People might say, well, we live in a developed country, we don't get it. No. In all the developed countries, and here I quoted a few slides from Germany, Denmark, and New Zealand, it's estimated to be 1 episode per person per year. So every one of us in this room, at least you had 1 episode per year happening to yourself. And from my personal experience, I guess we probably get more because we end up eating too much outside the place. And I think even with this one episode, it's probably an underestimate, because when you eat somewhere and you have a little bit of stomach pains, you vomited once or you have diarrhea, you're not going to go to the doctor, you're not going to report this. So many of these things, they go way under reported. However, this is the groups of the vulnerable people, our infants or our children that we care for, pregnant ladies and senior citizens. They are more likely to have more complications of that. It's very unusual to see an adult with dehydration. However, it's fairly easy for an infant to become dehydrated. The symptoms of biological food-borne illnesses are usually a combination of diarrhea, vomiting, abdominal pain, and stuff like that. Why does it happen? You know, the food plates and the serving trays are usually very clean, but the surfaces around it are not necessarily clean. And the food handlers will touch whatever, which is a doorknob or a surface or another plate or cash money or shake hands or whatever, and then they touch the food, and this is how the infection gets there. Also the temperature. The temperature above 4 degrees, which is 5 degrees and above, is well known to be very suitable for many of the bacteria and other viruses to flourish and cause the infection. Of course, if they don't have a good personal hygiene. The 2-hour rules apply for any kind of perishable food. Perishable يعني الأكل اللي قابل إنه يفسد. Any perishable food should not be left out of the fridge more than 2 hours. Obviously, this is from the European and American guidelines. I think this rule does not apply in UAE because the temperature is usually much more than the average temperature in Europe or the United States of America. The perishable foods include, for example, the meats, poultry, fish, fish, dairy products, rice, all salads and vegetables, or any kinds of fruits as well. So these kinds of foods, they should not be left out of the fridge 2 hours in a good temperature, and if the temperature is high, of course the 2 hours rule does not apply. Okay. You should set your refrigerator to be 4 degrees or below, and that's very much standard, and your freezer should be minus 17 or so to prevent the proliferation of the bacteria or the viruses. All right, so I will share with you some of the tips how to know what's the causative agent. For example, viral outbreaks usually happen with leafy vegetables, typically with salads, while the bacterial outbreaks are usually related to poultry or beef or any other kind of meat there. Typically in outbreaks of infections, usually there is a single etiology, one virus or one bacteria. The commonest of all is Norovirus, and I will talk about it in details in a minute. And the second commonest is the bacteria, the Salmonella. And this is the Salmonella enteridis, not the Salmonella typhi. This is that causes gastroenteritis, does not cause the hepatosplenomegaly that you all know. Of course, there is other bacteria like E. coli, Clostridium, staph, so on and so forth, and other viruses, and also protozoa like Giardia or Cryptosporidium. I will talk about that. احنا بالعربي واللي قل لي من تصاحب أقول لك من أنت. أنا غيرتها شوي. قل لي ماذا أكلت أقول لك what kind of bacteria or virus you got. So tell me what did you eat, I will tell you what kind of virus or bacteria you have. Seafood is well known either to Norwalk or Vibrio cholera or hepatitis A. Common question in the board, USMLE, حدا أكل seafood, whatever it is, and they have hepatitis A or some kind of Norwalk virus or Vibrio virus. Eggs, Salmonella. ويا مطار وزراء صحة من contamination. I think one of them was in UK. Eggs, Salmonella all the time. And even the eggs that you buy from the supermarket, the shell of the egg, it's very possible it's contaminated with bacteria, typically Salmonella. If you are eating chicken, Salmonella, Campylobacter, and other bacteria like even E. coli are there. And I advise you, whenever you eat outside, always ask for a well-done food or really well-done food. الناس اللي بيحبوا raw or medium raw or whatever, you are probably eating some Salmonella there or Campylobacter. المilk نفس eggs, usually it's Salmonella, of course Campylobacter and others. Hot dogs, never eat a hot dog that's not well done, because Listeria monocytogenes is well known to happen in hot dogs that's not well cooked. The second question, tell me when did you eat? When did you have the symptoms? I will give you some tips to say what kind of bacteria or virus you have swallowed. If it happens within hours of that, typically this is a pre-formed toxin. The commonest of all is staph. Usually you eat lunch and before dinner you have symptoms. This is typically a pre-formed toxin, staph, bacillus, and others. If you eat today and you get sick tomorrow, probably this is some kind of a virus or bacteria that needed some time, like Enterotoxigenic E. coli or Salmonella or Shigella or Campylobacter. The 7 days one, I will tell you the typical story. Very typical. Family goes to their home country, Jordan, Egypt, Syria, Pakistan, wherever. They come back, after a week the child gets sick. This is Giardia until proven otherwise. It takes 7 days to develop the symptoms. Viral illnesses usually affects the small intestine, so it will cause watery diarrhea. While bacterial causes, they cause large bowel disease and typically presents with blood in the stool. So if you see blood, this is bacterial. If it's just watery, then that's probably a viral illness. All right. Moving on. Of course, viruses are much more common than bacteria. And again, viruses, leafy vegetables, typically salads. Norovirus is probably one of the commonest. Norovirus is the commonest because of several reasons. The first reason, you just need a tiny bit of the virus. Only like 10 particles of the virus can make you sick. And it's very easy to be transmitted. One surface can cause all the food and cause all the problems there. It can be from food, it can be from water, and again from shellfish or others. With norovirus, the other thing is about it, you don't become immune to norovirus. يعني هذا الشهر you will get norovirus, next month you will get another norovirus, وبعد 6 أشهر you will get another norovirus, even if it's a small amount of the virus. Just only 10 viruses will make you sick. The good thing about norovirus is a short-lived virus. The disease usually resolves within a couple of days, and usually the symptoms are not bad, stomach pains and repeated episodes of vomiting. And if you go through the history, it happened many times, especially in army groups, like the whole, this group of army got sick with norovirus there. Of course, we have other viruses. I'm not going to talk about it today. Or the map of the rotavirus have changed with the recent vaccination. Rotavirus is still there. We see it specifically in immune-compromised patients, like liver transplant patients, inflammatory bowel disorders, and so on and so forth. Moving on to talk about bacterial causes. Again, bacteria, usually it's meat, poultry, eggs, milk, stuff like that. According to this publication in the United States by the MMWR report, they said Salmonella enteritis is the commonest, followed by Campylobacter. In this region, probably Shigella is much more common than Salmonella. And we see many of these patients, it's less likely to see Salmonella. The Salmonella we see in UAE is probably the non-typable one, usually the C, which is many times does not cause disease. Campylobacter, it's a rare thing in UAE. Campylobacter usually happens in other countries, and I think it needs like a colder environment. We talked about this. Salmonella again can present with fever. This is less typical for viral illnesses. Yes. Campylobacter jejuni, sometimes hemorrhagic, but that's not necessarily the case. Again, Shigella is probably more common in our region, and again, the infective dose is a small dose. I will have one slide about enterohemorrhagic and enterotoxigenic E. coli. Enterohemorrhagic because the E. coli produces a Shigella-like toxin. Usually it's in beef and other kind of meats that's cooked. It's a disease that will last for several days, up to a week or so. And from the name, you can tell enterohemorrhagic can cause bloody diarrhea. And this is the one that's associated with HUS syndrome, hemolytic uremic syndrome. Enterotoxigenic, this is a different kind of bacteria. It works through producing a toxin. Typical story, it's a cruise ship. People who go on cruises, they are more likely to develop the enterotoxigenic E. coli, usually watery diarrhea, and usually is not that bad. All right, I'm going to skip these. The other one, which I'd like to call it the forgotten cause, and this is probably, I believe it's probably one of the commonest, but way under-reported, is the Clostridium perfringens. And what happens with this, there's no bacteria in the food, it's the toxin that was pre-formed there, and it's probably even more common than Salmonella. Typical story, you go and eat, you have dinner, and at night, after a few hours, you develop the symptoms. Usually, it's not that bad. Diarrhea is not severe. And next day morning, you are feeling very well. And this is why it's way underreported and probably is more common than the others. And also because it's a spores, this is why it's so common, because if you have a contaminated surface, the spores will be there for a long period of time, and in the good environment, it will germinate and produce the toxins that can cause Clostridium perfringens. I will conclude, Mr. Chairman and Ms. Chairwoman, about the abuse of antibiotics. Most of the illnesses I mentioned to you, you don't need antibiotics. Of course, viruses, you don't need to give antibiotics. In Salmonella enteritidis, you should not give antibiotics, because if you give antibiotics, it's not only it's not going to work, but actually it will increase the carrier state, because the Salmonella will go and hide in the gallbladder, and there will be frequent secretors. If you give antibiotics for somebody with Salmonella and he becomes a chronic carrier, he cannot work in any restaurant in UAE. So you destroyed his future. So please don't give antibiotics for somebody with Salmonella enteritidis. Of course, there is exceptions, but I'm talking about in general. Campylobacter, this is a different kind of bacteria. If you need to give antibiotics, you should give something that like macrolide, because penicillins and cephalosporins will not work. So Campylobacter needs macrolide. So if you give amoxicillin metronidazole, it's not going to work. Of course, you have to be guided by the stool culture, but don't give other antibiotics if you have to. Shigella, yes, Shigella you have to give antibiotics. Enterohemorrhagic E. coli, you all know the association with hemolytic uremic syndrome. Enterotoxigenic, of course, it does not work because this is a preformed toxin. And Clostridium, of course, you don't need it. So as you can see from all the common causes, you should not give antibiotics. It's not helpful, and it might be actually harmful in some of these cases. So, ladies and gentlemen, I'd like to conclude by saying foodborne illnesses are very common, even in very developed countries. One episode per year per person, which is a fairly common disease. Viruses like Norovirus and others are probably the commonest. Norovirus, you don't become immune for it. You are likely to get the infection over and over again. Bacterial infections like Salmonella and I believe Shigella and Campylobacter are also as common, but again, most of them, they do not need antibiotics. Thank you very much for listening, and I think I am on time.